Nariza Uma is a resident of Buwenge in Kamuli district in eastern Uganda. Nariza and more than 7,000 HIV and AIDS patients often receive antiretroviral drugs at Buwenge Hospital in Kamuli district.
Amakerendezi abasawo tutubona kuwaire mulala ati tuzira buyambi buli kumala buli bwerere.
But for more than 2 weeks now, Nariza and her colleagues in Buwenge have not been receiving the drugs because of the doctor's strike.
Aye tuli bubi kuidagala lino wiki ibiri nze naja batusama busame buli lwe tujja batusama busame.
For people living with HIV and AIDS, the situation has gone from bad to worse as volunteers providing services like counseling have withdrawn them in solidarity with doctors.
Are also suspending our services with immediate effect. How did we get here? What is the tipping point? Healthcare is delivered in teams. For the last 2 weeks now, our team leaders, who are the medical workers, have not showed up to work in most of the public health facilities across the country. We expert patients cannot do anything anymore given the events without doctors who are our leads.
They told journalists there are hospitals which do not have ARVs.
At the moment, districts like Bishenyi, Bukomansimbi, Mbale, Moyo, Kanungu, Liantonde, Kisoro, Butaleja, Amur, Sironko, Bududa have reported shortage of ARVs and TB drugs.
The good news, however, is that no one can dismiss us as we work voluntarily on the secondment of our friends living with HIV in our communities. It is a waste of time for us to go on to continue going to the health facilities and observe the misery of our friends when we cannot offer them anything.
And these are going to develop resistance, and this is going to be a big problem to all of us, including those who are not yet infected.
We are not in a political debate or dialogue. We are in a mode of saving lives of Ugandans, who are our voters, who are our taxpayers, who are our children, who are our mothers, and who are our families. We cannot be talking while sitting on a bag of explosives.
Now, who is responsible? Whom should we direct to? The MPs, the Minister of Health, the President of Uganda. Who in actual sense is responsible for this issue?
The HIV prevalence rate currently stands at 6.5%, approximately 1.5 million Ugandans living with HIV and AIDS. A recent survey by the Minister of Health in Kampala metropolitan areas shows that the prevalence rate stands at 30%. Jingo Francis, NTV.